Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the office of Dr. Bernardfialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernardfialkoff. It's a pleasure to be back with you again tonight. And many of you have been asking, how do I avail myself of all the previous episodes? Very simple. Go on YouTube, click on A Time for Truth show. Hit the subscribe button. We'd love to have you as our member. There's no fee. And the purpose is bringing truth to our world. And God knows that we need that very, very badly. So tonight, I'm going to share with you some of my profession. Because as a periodontal implant surgeon of 46 years, there are many things that I have seen my patients suffering from. And many of them have wondered, did I have to go this way? Did I have to lose my teeth? Did I have to suffer through so much? You know, was it had to be so costly, so much time away from my job? And, you know, the soreness, the pain, the inflammation. The answer is no. And I want to share with you something that actually can keep your oral health, and more importantly today, your overall health, because the mouth is the gateway, that is really very simple. And we're going to talk tonight about the 3-month maintenance visits. 3 months maintenance visits. Why are they important? And why we're going to spend a segment on this. Well, I'll first ask you a few questions. When was the last time you had your teeth professionally cleaned? You start thinking. And if you're like most people, you probably are a little embarrassed. A little longer than I think, Dr. Fialkoff. Or, you know, they say, well, it's just for cleaning. My teeth are already white, and I use whitening toothpaste and strips, so I don't really need to have a cleaning. That's the other answer. Or the other answer is, well, I get it as often as my insurance allows. And, I don't really have much time. But here's the God's honest truth, is that your mouth is not something separate from your body. If you notice, it's connected. And what happens in this oral cavity and with your gums, we know scientifically affects your heart, affects your blood sugar. And God knows my Latin American family has tremendous problems with diabetes and blood sugar. It even affects your brain, and people get so concerned about dementia and intelligence. And tonight, I want to share with you why something as simple as a dental cleaning every 3 months can have such a powerful impact on your overall health. So, Buddha, if you put up the image, please. And, probably at this point, most of you have gone, and as you're watching this segment, or you're going to go afterwards, and you're probably go like this young woman and you look in your mouth and you're going to try and see, well, what's happening inside my mouth? Maybe I better check it out because, you know, the doctor mentioned this thing. And so if we go to the next image, engineer, and the truth of the matter is that there's many different germs, which we call bacteria, or in dentistry we call plaque. And Buddha, if we can, let's put on the next image. And these bacteria change. Some are helpful bacteria, but others are very harmful. And they transform from this sticky film that we call plaque in dentistry. When it's not removed adequately by your hygiene and flossing at the beginning, but over time, it turns into what's called tartar or calcified plaque, or what scientifically is called calculus. It hardens into this calculus. And now the point is that you can't remove it. And it's there. And so what happens, as you're going to see in this image that we're bringing out for you, is that that tartar transforms into a nice area for the bacteria to grow in. And now you can't remove it. It doesn't matter what you use, electric toothbrush, water flosser, whatever. And more plaque form, more and more bacteria. And they multiply in those areas, as you saw in the previous slide, and they transform. There are good bacteria and negative bacteria, just as the same in life. There are good people and there are criminals. These are the criminals that cause disease in your mouth. And so what happens is they irritate, the gums start becoming red, inflamed, bleeding, sensitive. Your body's trying to remove those criminals, those negative, destructive bacteria, which like to grow, by the way, without oxygen. And what happens is the body can't. So at first, it starts out very mild with something called gingivitis, but with time it progresses, and you start getting serious, irreversible bone loss. And that's the key, it's irreversible. And now what happens is you get recession, your teeth are sensitive, you're not comfortable, you get teeth shifting, you get dark spaces. You say, what's that dark space, Dr. Fialkoff? Or your wife complains that you had bad breath. You can't get rid of it. It doesn't matter what you do. And, you know, the surprising part and the dangerous part is that you're not going to know that it's even going on. So you're going to assume everything is okay, because the problem with periodontal gum disease and these bacteria is that the pain doesn't come until so advanced that you have an infection or an abscess. And at that point, many times, the tooth has to be removed, extracted. We have to do a bone graft. And the whole procedure now, eventually you'll need an implant to replace that tooth or have a denture that comes in and out at night. So we want to avoid that. Let's go to the next image, please, engineer. And let's see how common this problem really is, because as you can see on your screen, nearly half of adults in the U.S. have some form of periodontal disease or gum disease. And it's really drastic. And, you know, it's over 64 million, 30 years old or older. And adults are extremely affected, making it more and more common with age. And, you know, gum disease actually is the leading cause of tooth loss. So this is what you're going to have happen unless we prevent it. And so we want to do that because it's also linked, as we said, to heart disease, to diabetes, and even if you don't know it. And it's a silent disease, as other silent diseases, which are actually very dangerous. So let's go to the next image, please, engineer. And let's answer an important question. And what we do in the office is, why 3-month intervals? What's the importance of this 3-month interval? Well, you may say, well, my insurance covers every 6 months. That's what I'm supposed to have, because They're the ones who determine it. Well, I hate to tell you, but the insurance is a profit-making industry. They're good people. They try to cover you, but they're not looking at scientific basis of why 3 months. Because the bacteria in your mouth are not going to wait for your insurance company to say you're due for your cleaning. The bacteria are multiplying every day, and the harmful bacteria take a certain amount of time to grow to dangerous levels. It happens in about 3 months because the environment changes in the mouth, and now within these tartar deposits, there's a low oxygen level. And these destructive bacteria grow in this low oxygen level, and they start invading your gum tissue. So waiting 6 months between your cleanings is, to give you an example, it would be like instead of putting your garbage out once or twice a week to be taken away, you're going to do it maybe once a month. You can imagine a disaster. Your wife's probably going to be very upset with you because of the smell around the house. And that's what's actually going on in your mouth, although most people don't realize it. So they take mouthwash, or they try to do other remedies to try and get rid of this taste that they have, that they don't understand why, because they think that, well, I'm having my cleanings every 6 months to a year. So what happens is, if we have it at the 3-month interval, now we have things under control. And at the same time, the beautiful part of it is, not only are you going to be healthy, your teeth are going to be white, your mouth is going to feel fresh, and you're going to be free of the danger of also developing cavities, tooth decay. Because as your bacteria expand, this is the other problem that occurs. So let's go on to the next slide. And, this is important to take a look at here, as we see here, and you see the interaction and the connection that's scientifically been documented, which is why it's so important really to take care of your mouth, because it's a gateway to these other diseases. And so what happens is you start getting inflammation. Inflammation is the basis of all disease, of dementia, of arthritis, of diabetes, of pulmonary problems, chronic obstructive pulmonary disease. Really, of any disease, the common denominator is inflammation. And so, what we want to do is obviously avoid that inflammation. Now, what happens is this inflammation, once it develops in the mouth, and these bacteria start populating in the mouth, they don't just stay in the mouth. There's no customs in the body. They don't need a visa to go from one area to another. And some of you may be wondering why all of a sudden you develop certain problems. You have to realize that the same bacteria that can cause a skin infection, and I recently had a friend of mine who cat bit him in the arm, and he developed what's called a cellulitis. Why? Because the bacteria in the cat's teeth entered below the skin level, so actually dangerous. He had to be in the hospital for about 3 days on intravenous antibiotics because these bacteria are not innocuous. In other words, they're not harmless. They can enter your bloodstream, they can enter the tissues, they exude toxins, and they cause a lot of havoc in the body and contribute to the inflammation that we now know as disease. When they get into your system and your bloodstream, they go to your lungs, they go to your gastrointestinal system, your digestive system, and other organs throughout the body. There is no restriction. So it's not just something that's going on in your mouth, but it's something that's affecting you overall. So if you're finding, after this show you go and you say, well, my gums are bleeding when I brush. Maybe I brushed too hard. No, you didn't brush too hard. You have inflammation. And you should go see your dentist for a cleaning. If you're not, floss at nighttime, because that's a signal. It's not something that you just did, or you may bite into an apple and you say, wow, that apple was really hard. I see blood on the apple. Again, no, that's not the answer. The answer is that you have inflammation, you have bacteria, and it needs to be what's called in our office debrided or removed and irrigated so that you can stay healthy. So let's go to the next image, okay, and let's talk about interactions, which are very common in our country. Here you're looking at diabetes, and here if you look at it, how it raises the risk of periodontal disease, which I see very often in my practice as a periodontist. And what happens is that, how would you know this? Well, you would feel that, you know, there's a dryness in your mouth. You may have a lot of thirst in your mouth. And, you know, when the dryness occurs, and the medications are used for diabetes create dryness on top of this, what happens is that saliva is necessary to prevent tooth decay because it washes away debris. But when you don't have that saliva, the acid-producing bacteria start creating cavities in your teeth. That's what the dentist does, your plastic fillings, your silver fillings, your bondings. And the saliva also has minerals like calcium that help protect the teeth from this decay. But as I said, these medications can affect you. And when there's less flow, now you have more disease. Diabetes also increases the sugar in your mouth because it is a disease of sugar metabolism and control. And when you have that sugar in the mouth and it's too high, it's a great diet for the bacteria that we're trying to control in your mouth. And these harmful bacteria then form and grow, and they start becoming sticky, more of them, and you start getting a lot of inflammation. I see this quite often in my diabetic patients, and it's very important because sometimes you're trying to control your sugar, but you don't realize it's not the sugar as much as what's going on in your mouth that's causing inflammation, and it's exacerbating, it's making worse your control. So it's important to realize that we need to control that diabetes, and because otherwise we're going to end up with tooth loss. And you know, with many diabetics, you know, the ages of 50 and older experience severe tooth loss. I have many of them in my practice, and you know, unfortunately, they end up needing implants. If they can't afford them, they have dentures, but they're not comfortable with their dentures. So it's something you really want to avoid. Let's go to the next image, and we'll take a look at smoking. And smoking also increases your risk with your periodontal disease, also, you know, with diabetes. So it's all interrelated. In fact, smokers are 2 to 7 times more likely to have gum periodontal disease, and 3.5 times more likely to experience tooth loss. So really, ceasing smoking really is so important. And so we look at this and we have this association: smoking, periodontal gum disease, cardiac heart disease, and diabetes. And smoking acts as a multiplier. So whatever already I spoke to you about, smoking now multiplies it. And you're 30% more likely to develop type 2 diabetes if you smoke, and you face 2 to 4 times higher risk of heart disease with smoking. So it's important to realize that it's something that we have to take a look at controlling. And so if you're smoking or marijuana, and I warn you that marijuana is actually even worse than smoking, causes even more periodontal problem, causes problem with more with healing. And it actually, in my office and really in many of the offices of dentists, we have found that the marijuana is even worse than the cigarette smoking in terms of your periodontal disease, in terms of avoiding tooth loss, in terms of not getting recession around those beautiful veneers that you wanted to get done. So if you want to keep that beautiful smile, if you want those veneers to last, if you want that Hollywood smile, we have to eliminate that smoking, eliminate those high sugar foods that are not really going to be adequate for you to control your disease, and so you can stay healthy and stay smiling the way you want. Let's go to the next picture. And let's see what happens if you skip your regular cleanings. So let's go to the next picture, Buddha. And there we go. What happens is you get inflammation. There you see something from one of the major magazines in the country. You start getting bleeding. You start getting tartar. You get more bacteria. You get more inflammation. You get swelling. Your gums are very sensitive. They're sore. Your teeth start to loosen. And as I explained to you, you end up coming to see someone like me, a periodontal implant surgeon, and we do an exam. We take a full mouth series of x-rays, and we see how far the bone has been lost to. But realize that bone more or less is irreversibly lost. We can regenerate somewhat, but it's a very important disease to prevent. If you want to keep your teeth, keep your smile, keep your comfort, decrease your dental costs, I would disregard your insurance coverage as far as cleanings and maintenance visits and go every 3 months. For the small amount that it is, it'll more than pay you back. You know, people look at return on investment. Well, the return on investment of you getting a cleaning with your dentist or with someone like us as a periodontist is tremendous. And you have to realize also the overall impact, not just on your mouth, but in your entire body. So if we go to the next image, most people would say, well, Dr. Fialkoff, what do I do at home? What do I check in my mouth to see? Well, what you can do is go in front of the mirror, see if you have redness. See if you have puffiness or they're very shiny. Your gums look very shiny to you. Or see if you were brushing and there's blood on your toothbrush, you're flossing, there's blood on the floss. See if you have a dry mouth or you have excessive thirst. Or you take a look and see if your gums are receding. One of the tips I want to give you if your gums are receding, make sure you have enough collagen in your diet. So have a diet, have some collagen powder. Especially as you get older, the body gets devoid of collagen, and collagen is the matrix or the structure of your gum. So if you want to prevent recession, have a little more possibility of maintaining the height of your gums, make sure you have adequate amount of collagen powder during your day. I happen to take it in the morning. If you feel you have loose teeth or dark triangles or spaces, if you're experiencing sensitivity, if ice is bothering you, or you have some bad breath that we call halitosis that doesn't go away, and you try to brush it and floss it and whatever, what you need to do is come to our office or to your dentist office and have a maintenance cleaning. You'll find that the bleeding will disappear. We'll go over with you what to do. And during this visit, much more occurs than just polishing the teeth. Polishing is what we do at the very end, because first we have to get out the calculus deposits with a special instrument that vibrates 40,000 cycles a second with water. It irrigates everything out in a gentle manner, much faster than the hand could do and much gentler, and then removes all that tartar. And then what we do, we also examine you. We want to make sure that there's no other reason why you're having the bad taste. Cavities can also create bad taste. Sometimes you get ulcerations from stress. They're called aphthous ulcers. Some are herpes ulcers. And sometimes, unfortunately, we find other pathology. But if we catch it early enough and control it early enough, it can be removed. It doesn't become something that can be life-threatening. So it's very important to realize that these visits are much more than just tooth polishing. And tremendous impact that why we're having this presentation for you tonight. So if you work together, what happens between your dentist, between our office as a periodontal implant surgeon, between what you do at home and with your flossing at nighttime, which you definitely, I would want to stress to you, should do, together as a team, we control this disease. And this is really the best way of maintaining your comfortable, pleasing smile, your confidence when you go out and you're at a party. And think of these 3-month cleanings as, basically what you would do if you're a woman, taking off your makeup at night. If you're a man, maybe it's you like to go to the gym, and exercise. It takes effort. Everything that's worthwhile in life takes some effort, some discipline. Let's go to the next image, please, Buddha. And over my 46 years of specialty practice in Queens, I've presented many, many times. This one happens to be at the Somos conference in Spain with my friend, Dr. Ramon Talaj, who invited me to speak. And, there's so much we have to share, but the important factor is to be timely with what we're doing. And the patients who wait too long and come to our office when they're in pain or referred by the dentist, it's going to be complicated. It's going to be costly. It's going to take time. It's not something you really want to go through. And if you have to go through it, we do it as well as possible, as quickly as possible. But it'd be much better to avoid it and to keep your health overall and your smile and your appearance. So if you commit, what will happen? You'll stabilize, you'll maintain, you won't come too late. I've had young women who are in their 40s who lost their teeth at a very early age, who actually can't even have implants anymore. Because once you lose your teeth, the bone that supports the implants resorbs, and even implants are not possible in certain cases. So it's not something that's a simple thing. We can't reverse everything. And when we can, it's very sad, and it's not a pleasant moment for any of us. The patient, you, the patient, or really we in the office. So it's really about preventing and maintaining, and to really make sure that, like we do other hygiene procedures, like the washing that we do, like the sanitizing that we do after a meal, like what we do in a house, we need to do that for ourselves. Sometimes I feel that we forget ourselves and we come last. Somehow we think we're immortal or that nothing will ever happen. And, and later on we get very upset, or it's like we're crying at the cemetery. Let's not cry at the cemetery. Let's do something to preserve that smile. And let's not cry. Let's smile. Let's have fun. Let's have confidence. Let's move to the last slide. And if there's one last thing to remember is you don't want to wait. Let's put on, there we go. You don't want to wait. You don't want to wait so that your periodontal disease gets so advanced that it affects your diabetes. I have many patients like that in my practice. And when they come in, I exert discipline on them. And I explain to them, you have to control your gum disease. You have to come in for your cleanings. You have to floss at night. You have to brush at least twice a day. Don't use too much toothpaste. You're going to wear your teeth away. But be conscientious. Because you don't want to wait until you have a problem and a crisis to come in pain and have to go through these procedures. A simple habit of brushing twice a day, a little toothpaste, flossing at nighttime, and having your cleaning every 3 months will more than prevent your problems for the rest of your life. Your mouth, remember, is the gateway to the rest of your body. It's your smile. And cosmetics is such an important part of our lives, the way we look, the way we feel, the way we portray, when you go on an interview, when you're meeting some significant other, or when with your friends. It's important to feel that confidence and that you are coming across well to other people. So take care of yourself. You're worth it. It lasts a lifetime if you do, I have a little sign in my office. You don't have to floss all your teeth, only the ones that you want to keep. But let's not do that. Let's take care of all of them. Let's have a pleasant, confident smile for the rest of your life. And let's wish you a tremendous amount of good holidays where you enjoy your food, where you speak comfortably, where you smile broadly, and you look back on this show from A Time for Truth and you say, wow, it really worked. And it will. I promise you, 46 years, I can tell you, it's a fact. So I hope you've enjoyed this segment and that you have a wonderful week. And we'll see you on the next episode of A Time for Truth show. Have a very good night.
This show was sponsored by Atimefortruthfoundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet